Welcome back. A study by the Human Sciences Research Council says significant work remains to reduce stigma around people living with HIV. According to the report, half of the participants voluntarily disclosed their HIV status primarily to family members, followed by friends and partners. South African National AIDS Council's Pholo Ramothwala joins us to discuss this further. Pholo, very good evening to you and thank you so much for your time. So this study had a sample of over 5,000 participants from all 9 provinces in the country, focusing specifically on about 18 districts, both urban and rural. When you look at the progress that's been made since the 2014 HIV stigma index, what do you think still is the most deeply rooted causes of the persistent stigma that people living with HIV and AIDS still face today?
Yeah, thank you for having me. I think the first point is that the study was actually conducted by people living with HIV, supported by HSRC. So in terms of 2014 and now, look, we've made progress. I think I was part of a group that conducted the 2014 stigma index. We've made progress in, you said that about half of the people who were surveyed are now accepting of their HIV status. The community members are accepting of them. So we're making progress in community members understanding that people living with HIV are human beings like everybody else. Where we are lacking is what in the area of internalized stigma, where a lot of people are still feeling like, they did something wrong for being infected with HIV. They feel ashamed. And that's the area that we need to focus more on, because most people who experience internalized stigma, they tend not to want to go and access treatment. They experience mental health issues that we feel that we need to focus on. But we have made a significant progress.
You speak about this internalized stigma and the effect it has not only on self-esteem, but also just on the mental issues. What advances do you think we need to make, particularly in our healthcare systems, in order to address these internal barriers and have that adherence to treatment?
Yeah, there are very clear recommendations from the report itself. And the reason I mentioned that this was led by people living with HIV, because they are making recommendations that we need to intensify sensitization of healthcare workers so that they are able to treat patients who go to clinics with respect and dignity, so that the people feel empowered to be able to go back and seek medical assistance when they need. That's actually one of the findings, that the healthcare facilities need to do more to ensure that there is less stigma. So it's a significant recommendation. But also we are recommending that the community members at community level, there needs to be more and more sensitization around what HIV is today, because I think there's also a misconception. Some people still feel that, you get infected with HIV, you're going to die, or how people got infected with HIV, it's still important. And we are saying that it's no longer important. We need to be treating people with dignity.
Do you think the awareness campaigns and the education around HIV and AIDS has lessened over the years, and this is why some of that stigma still persists?
Yeah. So if you look at the previous study that the HSRC conducted around, awareness, there's clearly a decline in people understanding more about HIV. I believe that advocacy by people living with HIV and coverage like this through media has sensitized members of the public to understand more about HIV. So there is a decline in HIV knowledge, but a sensitization around living with HIV, we feel that is improving, even though we could do better.
The study also highlights that about 38% of people living with HIV are members of support groups. Just talk to us about the importance of finding a support group, and what strategies do we need in order to have some of these community-led support groups existing so that people can be a part of them?
So support groups are important because we speak to a lot of people who are dealing with being HIV positive on their own. And I had indicated earlier that these are some of the people who then experience internalized stigma. So when you are a part of a support group and you meet other people who are living with HIV, people share experiences, people share lessons learned, and then it empowers those who feel that they are lagging behind to know what to do. They can ask questions, and then they learn from each other. And the hope is that the more you participate in support groups, then you are able to empower yourself, and then you take care of yourself better. And also being able to deal with mental issues that when you are isolated, they might be difficult for anyone.
And of course would encourage disclosure as well. But I suppose in order for you to disclose, the environment should also be allowing. And there's the study
Correct.
shows a very limited HIV disclosure, especially in professional and educational settings. What do you think needs to change within our workplaces and schools in order for people to disclose without discrimination?
Yeah. So look, in the education setting, there is work that is being done to sensitize educators, to sensitize young people more about HIV and acceptance. I think the one that was a bit surprising was in the workplace, because workplaces are seen to be doing a lot in terms of HIV education. But what we've seen as a limitation is that to get employees to come and test for HIV on World AIDS Day and have a few banners, it's not enough. So you need to have consistent messaging in workplaces to your employees, using messages that your employees understand, so that we can start dealing with that stigma in workplace settings. So there is work that is being done, but we need to do more and have packaged messages that is understood by the employees that people that companies employ.
Are we edging anywhere close to attaining some of those objectives of our national strategic plan?
Yes, so my role is I'm responsible for goal 1 of the strategic plan, which is breaking down barriers that prevents people from accessing health services. We are making progress, but we need everybody to come on board. We need members of the public to be open to understanding HIV, people living with HIV, people living with TB, and also key populations. There's still stigma around men having sex with men, sex workers, and others. So our approach is that we're breaking down barriers to ensure that everybody who is a South African, who's a human being, are protected and their rights are protected, and they don't experience any form of stigmatization and discrimination.
In that goal 1, in breaking down those barriers, what would you say would be the most hopeful signs for us as a country, or just those emerging opportunities that give you confidence that we will reduce this HIV-related stigma?
Look, we need to reduce stigma by intensifying awareness. The level of awareness when it comes to HIV has dropped. We need to intensify education around, access to justice. And what we mean by access to justice is that sometimes people experience rights violations, stigmatization, discrimination, but they don't know where to go. So we look at ways that we can encourage people to be able to access justice. We try to ensure that people understand more about mental wellness, so that when a person is feeling isolated, they know where to go for support. We're encouraging engagements with the police, for example, law enforcement, so that when a person goes to a police station and they've experienced any form of violation, then the police are able to help them without judgment, without laughing at them to say, but this is not a case. At least, even though it might not be a case, but then that level of communication and treatment that is positive helps somebody to be able to cope with whatever experience that they've had.
All right, Pholo, well, as you mentioned, there are some gains that we have made with regards to the stigma around HIV and AIDS. And thank you so much for the work that organizations such as the South African National AIDS Council is doing in ensuring that we're breaking down those barriers. Thank you so much for your time.